WDET. I'm Robin Vincent. People voted for President Trump in part because he doesn't care for public institutions. He does what he wants. And for that, his voters believed he would bring about positive change. Change is, in fact, happening. We're speaking as Trump and Israel have started a new war with Iran. Change is also happening in public health. In Michigan, fewer people are getting vaccinated. More people are sick, and less people have health insurance. Life is also different for people who lead public health institutions. But what exactly do those changes look like? How has the day-to-day job changed for public health officials in Michigan? Kate Guzman is the Oakland County Health Officer. She's here to discuss the measles outbreaks, the rise in flu cases, and what she's trying to do to continue to keep people healthy during President Trump's second term in office. Kate, welcome back.
Thank you so much. Good morning, Robin.
Good morning. So, America is seeing a significant measles outbreak. Last year, the U.S. saw over 2,200 cases of measles. And that was the most cases this country experienced since 1991. Already, America has recorded over 1,100 cases. Am I getting these numbers right?
Absolutely. Yes, you're spot on.
Kate, why does this matter? How bad is it to get the measles?
Measles is one of the most contagious illnesses that we experience. And to see this rise across our country is significant. But more importantly, looking at the rise of measles cases globally is so important to understand the full context of this outbreak. And so, like you said, we've got over 1,100 confirmed measles cases in the U.S. this year across 28 states. South Carolina is struggling. This year alone, they've had 653 cases, but their total outbreak is almost at 1,000 cases.
Wow.
We've got Utah and Florida being very hard hit. But something that I don't think is being discussed enough is that the cases in Canada and Mexico are also rising. So when we're looking at vaccination rates and we're talking about infectious diseases, it's not just about our country. At this point, with global travel and even national travel, we can't look at just our own country or just our own state. We really have to take into consideration the global picture. And cases are on the rise dramatically around the world. So just to keep in perspective, measles is so contagious compared to other diseases. We in public health look at this number called the R naught, but really it just is how many people would get infected if they were not vaccinated, how many unvaccinated people would get infected from one infectious case. And for measles, it's between 12 and 18 individuals that would get infected from a case, right?
Can you paint a picture for us what it actually means if I am, let's say, in a room with someone who has measles? Give us a better idea of when you say that this is highly contagious, like what that actually looks like, how the disease moves from one person to the other.
Yeah, no, it's a great question. Measles is airborne. And it travels like a typical virus, like you and I would imagine, and all the things we learned in COVID about how viruses transmit between individuals by coughing, sneezing, talking, laughing, but also by leaning on surfaces that we touch and then touch our faces, touch our eyes. Measles, though, it's just this really strong virus. It actually hangs in the air for 2 hours after someone has coughed or sneezed. So it's in the airspace.
Would that be more than COVID?
Oh, definitely.
Hangs
Most
in the air.
viruses they just fall to the ground, fall to the surfaces. They don't just sit in the air waiting for their next victim. So imagine if I have the measles right now and I'm in your radio station and I'm laughing, I might cough, I'm projecting measles virus into the air, but you're vaccinated. You're sitting right across from me, but you're vaccinated. You're really not at risk.
I'm safe from
You're
your
safe.
measles.
Exactly.
Why didn't you get vaccinated?
And so then your next guest comes in, and it may be a half an hour since I've left, but that measles virus particles are still hanging in the air. So the next guest comes in, they're vaccinated, no risk to them, they leave. But the next guest, an hour later, comes in, and guess what? They only had one dose of vaccine when they were a child. They're not fully vaccinated. and they've got some immune system issues. Maybe they've got diabetes, so they don't have a great immune system. And they come in and they sit here, they're talking with you for 15, 20 minutes, and they leave, and pretty soon they're getting a fever, starting to feel cruddy. A few days later, their rash starts. So the fact that it hangs in the air makes it so dangerous because so many individuals pass through public spaces. So when we're thinking about just the world we live in, if you think about your activities over the course of one day, if you had, or we're still talking about me, for example, if I'm the measles case, I'm contagious 4 days before my rash starts, so I don't even know I have the measles. I think about my day yesterday. I was at Kroger. I was at a soccer game. Maybe I went to church. I'm everywhere.
You came in contact with a lot of different people, and this became part of the public consciousness, this idea of all the different folks that we come in contact with during the height of the COVID pandemic. And we started talking about contact tracing and, this person has come down with COVID. And so now public health officials are going to try and find out all of the different people who may have been exposed. And to your point earlier, these diseases know no borders. And so if Americans are traveling back and forth between Canada and Mexico, then this is circulating even further when we think about the footprint of these diseases. I do want to think about why we're seeing big outbreaks specifically in the states that you listed, South Carolina, Utah, and Florida, and then we're going to move to Michigan.
Yeah, no, great questions. I don't want to stigmatize any one community, but we do see clustering of unvaccinated individuals in these communities with large outbreaks. So I know in South Carolina, in Spartanburg County, there's a large community of Ukrainian and Russian immigrants who do have lower vaccination rates.
And this is because there's a lot of distrust when it comes to the government.
Absolutely.
These are folks who are coming from places where there have been oppressive and authoritarian regimes, and coming to the U.S. where there's an increased mistrust in the government now. That this makes sense that there are immigrant communities that are going to not be lining up to get vaccinated.
Yes, and in other states, there are communities, we call them plain communities. We're looking at Amish and Mennonite communities, have traditionally not vaccinated. This is not new for those communities, but the introduction of the virus into those communities is particularly dangerous because we've got a cluster of unvaccinated individuals.
Do you expect Michigan to get a lot of cases of measles or other diseases right now that folks could be vaccinated against and protected from?
I do. We will see some, Robin. I was looking at our vaccination rates. Again, we look at the vaccination rates of children aged 19 to 36 months as a key indicator of our overall vaccination status. And between January of 2025 until February of 2026, so within the past year, our vaccination coverage fell from 72% down to 69%. Robin, I have never seen it fall this low. We fell right after COVID, but it was short. We popped right back up again. This is a steady decline. It's very concerning to me to fall into the 60s. When we look at a disease like measles, it's so contagious. We need 95% vaccine coverage to provide herd immunity against measles, 95%.
And we're at 69.
69. That's not specific to the MMR vaccine. It's all of the childhood vaccines for that age group, but that measles, mumps, and rubella vaccine is part of that series.
Okay, so code red.
Yeah, exactly. Thank you. That's what I'm saying. That's why I'm on your show, Robin. Code red.
Yeah, so are you having emergency meetings right now with your colleagues, with other public health departments? I mean, this is a continuing theme that you and I discuss whenever you're on the metro, and it sounds like things are progressively worsening.
It's such a challenge. This week is so timely. We are looking at our fiscal year 2027 budget right now. Our general fund budget was due to our fiscal services on Friday. All last week, I spent time thinking about how do I reallocate resources so that we have more capacity in our communicable disease unit, that we have more nursing capacity, more epidemiological capacity in order to respond to outbreaks. But what that does is it pulls my resources from other core services that are so essential when I'm looking at maternal and infant mortality and morbidity, for example. Our home visiting nurses going out to work with pregnant women and new babies. I'm pulling resources. So how do you make that choice?
How are you making that choice? What do you decide in terms of concessions?
Well, hopefully we won't need to pull in those extra resources for a communicable disease outbreak, but we have them on standby. We hope that they're temporary, and so that we would see a temporary pause on some of the other services in order to divert those resources to an outbreak. COVID taught us a lot about capacity and infrastructure in public health, and we saw all of our other services suffer as a result of the attention that needed to be focused on COVID-19. This will happen, and whether it's measles, whether it's polio, whether it's H3N2, whatever it is, you will see other services suffer, which is tragic in public health because we need those core services to stay active and engaged in order to keep the health of our community strong through this.
I mean, what we're also talking about here is how interconnected communities are to each other and how connected we are to the broader rhetoric that's happening. I mean, I'm thinking right now about what's happening in the U.S. Senate, which is considering Dr. Casey Means for Surgeon General. Dr. Means didn't finish her residency and doesn't have an active medical license. She's known for supporting the Make America Healthy Again movement, which we know is very popular and does have some promising goals in terms of getting folks to eat less ultra-processed foods, for example. But it is also advocating for people to eat more beef, which we know there is plenty of research showing that that increases your risk of cancer. Now, she also, importantly, won't urge parents to get their kids vaccinated for measles, the flu, or the whooping cough. I want to play a back and forth between her and Democratic Senator Tim Kaine during her confirmation hearing.
Do you believe that there's no evidence that the flu vaccine has efficacy in reducing serious injury or hospitalization? This is an easy one, doctor. This is an easy one.
I support the CDC's guidance on the flu vaccine.
Extraordinary, really. What do you make of the answer Dr. Means gave?
Well, I deeply feel that response. This is an easy one. This is an easy one. As the spokesperson for healthcare in America, as the nation's top doctor, which is what the Surgeon General is for our country, that message should be simple and clear. Vaccines save lives. The flu vaccine is broadly recommended for Americans to save lives.
If Dr. Means becomes the U.S. Surgeon General, what could that signal for you and public health departments across the country? I mean, would there be any consequences for you in Oakland County?
The consequences that I foresee, whether it's Dr. Means, honestly, or the next nominee. If Dr. Means is not confirmed, there will be another nominee that reflects the MAHA movement. I'm resigned to that. The Surgeon General doesn't have a broad impact on public health in the way that the HHS director does. However, the Surgeon General is an advisor of the president, an advisor of the secretary of HHS, right? They're also such a prominent public figure that my main concern is just, again, the distrust in public health, the further polarization of us versus them, red versus blue, just inserting politics into healthcare and into public health decision-making where it has no place.
I mean, Kate, I did mention there are some things that I realize health officials and health leaders say are good things coming out of the Make America Healthy Again or MAHA movement. Do you see good things, and are those good things overshadowed by what you're talking about right now?
Yes, it's fascinating because there are many aspects of the Make America Healthy Again movement that I am completely on board with. I love the focus on chronic disease and really investigating the root causes of chronic disease because honestly, as the health officer, I'm looking at what is in all honesty, killing my community? What are Oakland County residents dying from? What's making them sick? And
What
it's
are they dying from?
Heart disease. It's heart disease number one. And so how can we really lean in and dig in on the causes of heart disease? So we're looking at diet and physical activity. And I know that within the MAHA movement, they're looking at the same things. We have so much in common, but that's where that polarization is causing so many problems. Instead of focusing on our differences, such as a birth dose of hepatitis B vaccine, we need to be focusing on our commonalities. And the commonality is, how do we increase the longevity of Americans? How do we increase the well-being and the health span, not just the lifespan, but the health span of our residents?
So this is a little bit of whiplash for you then, because it's become this either or, and instead you'd like it to be and.
Absolutely. Absolutely. I think for me, I've always been someone who can easily kind of cross over boundaries and see both sides of the situation. I'm not someone who is so dogmatic that I have to stay focused on just this is my viewpoint. I love to hear differing of opinions. It broadens my mind. I'm interested in it all, and we all should be that way.
Well, you are quite adaptive, Kate Guzman, because I realize you have changed the strategy in Oakland County when it comes to the vaccine schedule. You have changed it to be something where you are saying with open arms, whatever you're willing to get vaccinated against, we're here for you. You don't have to do every shot if you don't want to.
Yes, we're trying. I'm trying to get that message out. Please let us meet you wherever you are at. We will have a conversation. We'll have a discussion. This is a dialogue, because one vaccination is better than none, and 5 are better than 4.
My guest is Oakland County Health Officer Kate Guzman. We're discussing how her day-to-day job has changed because of the policies and messaging coming from the Trump administration and the consequences that it's having on Oakland County residents. And I do want to zoom in a little bit more on folks in Oakland County, and certainly this is affecting folks in many counties around us, and that is Republicans in Congress did not extend the Affordable Care Act tax credits for health insurance premiums. And so a lot fewer people are getting health insurance. In Michigan, that is looking like roughly 40,000 fewer people signing up for the ACA. What are the consequences of that in local communities like the ones in Oakland County?
Yeah, the impact of the subsidies being gone for the Affordable Care Act has really impacted our community. Our boots on the ground colleagues are reporting that even though some people were still eligible for subsidies, the expanded subsidies were gone, but there's still some basic subsidies left for the programming, for the healthcare coverage. People just assumed that they weren't eligible and just didn't apply. So it's leaving an uninsured gap in our community that we haven't seen in quite a few years. I honestly don't know that we can quantify that yet, because these are fresh from January. But the ripple effect will be that people are not seeking preventive care because it's not a priority for them if they're paying out of pocket for it. So being totally uninsured means you're making decisions about whether or not this is important enough for me to dish out money that I could have put toward rent, or I could have put toward food, I could have put toward clothing, my gas, anything, right? And you're making that decision, where in the line of my priorities does my healthcare or the healthcare of my family fall?
So we're talking about less preventative care, which is going to have major impacts for people. It also creates additional burdens for the healthcare system itself.
Absolutely. We're looking at increased visits to the emergency departments, urgent cares. And what happens is that the individuals, the patients seeking care, will be sicker than they would have been previously. So not only are there more people going to the emergency departments, more people going to urgent cares, they're going when they are in worse condition. So their acuity is higher. It's such a burden on the entire system. In Oakland County, on a very small scale, we are trying to make an impact. We have launched the Oakland 360 Care Center. It is a 7-day-a-week urgent care in Pontiac that is a safety net clinic, a no wrong door clinic.
What does that mean?
Yeah, no
door.
wrong door. If you have insurance, if you don't have insurance, if you have some insurance with a very high deductible, if you have documentation, if you don't have documentation, if you're in a mental health crisis, whatever it is, come to our clinic.
Say the name of the clinic again.
Oakland 360 Care Center. We've launched in downtown Pontiac. We have a second location in Hazel Park that we are launching soon, hoping that this model of 7-day per week access provides an avenue for people that don't have insurance. It's where they can come and not feel like they will be burdened with healthcare bills and be sent to collections.
Of course, there are folks who are leaving their homes less and less right now. I mean, Kate, the last time we spoke, you talked about trying to do home visits for people. I mean, I'm thinking particularly about folks who are undocumented or who aren't American citizens. Those are folks I'm guessing are not going to be able to, or are going to be fearful to take advantage of the clinics that you're talking about. So how is it going? Have you been able to perform more of these home visits?
I wish that I could tell you we are, but honestly, Robin, people are not taking advantage of this opportunity. And at the Oakland 360 Care Center, I can tell you our percentage of Spanish language patients dropped in January from 52% in December all the way down to 36% in January. So it's staggering. Even in our own clinic, we can see that Spanish speakers are not coming in seeking services like they were. We are trying to get the word out. We are able to provide so many of our services either virtually or in home visits, and we're just not either not getting the word out successfully or people are just not trusting us.
I wish we could end on a bit of a hopeful note here, Kate Guzman, because it's feeling like a really dire moment for public health. And that means that it is a severe moment for all of us because of the interconnectivity of our communities. I mean, how do we end feeling a little bit hopeful about the future?
I get hope when I look at the rise of unified messaging coming through from the American Academy of Pediatrics and the obstetrics and gynecologists. When I see that some of our professional organizations are coming in and filling the void that was left by the CDC and honestly our government, it gives me hope. There are so many healthcare professionals that are passionate about the work that we're doing, that we're coming together in a new way and reforming how we look at public health.
Well, it's clear you're passionate about the work that you're doing as well. Oakland County Health Officer Kate Guzman, thank you so much for joining me on the Metro.
Thank you.
It's the Metro on WDET. I'm Robin Vincent. Coming up, a Wayne State sociologist argues that the people with the most power to define this city's problems understood it least and profited most. Nicole Trujillo Pagan on her new book, Detroit Never Left. That's next on the Metro. Stay with us.